Hello everyone. Today we're discussing this crucial Osteogenesis Imperfecta awareness poster designed specifically for rehabilitation staff. This poster isn't just about clinical guidelines. It's about transforming how we approach care for our most vulnerable patients through cultural humility and evidence-based practice. As staff working in Hong Kong's diverse healthcare environment, we must recognize that effective patient care extends far beyond technical skills. It requires a deep cultural sensitivity and humility in our approach to both patients and their families. Cultural humility is fundamentally different from cultural competence. While competence suggests that we can master knowledge about other cultures, humility acknowledges that learning is ongoing and patient-centered. In our multicultural Hong Kong healthcare system, this distinction is critical. For OI patients and families, cultural humility means recognizing that families are the experts on their loved ones' conditions and needs. Understanding that cultural beliefs about disability, pain, and medical intervention may significantly vary across communities. Acknowledging that language barriers and cultural differences can impact trust in healthcare providers. This poster embodies cultural humility principles in several ways. Firstly, it emphasizes asking patients and families for guidance. The repeated message, when in doubt, ask the patient or family, recognizes that families often have deeper knowledge about safe handling techniques than healthcare providers. Secondly, this poster provides bilingual content in both English and Cantonese, acknowledging Hong Kong's linguistic diversity. This demonstrates respect for language preferences and removes barriers for understanding. Finally, this poster emphasizes collaboration over authority. Rather than prescriptive commands, this poster encourages partnership between healthcare providers and families, principle of cultural humility. When communicating public health content to rehabilitation staff, cultural humility becomes even more critical. Healthcare providers bring their own cultural lenses to patient care, which can unconsciously influence their interactions with diverse families. Effective public health education must address these dynamics. This poster serves as both a clinical guide and a cultural bridge, helping staff recognize that, while firstly, pain expression can vary across cultures, and what appears as overreaction may be culturally appropriate responses. Family involvement in healthcare decisions differs significantly across cultural groups, and trust in medical authority is not universal and must be earned through respectful, humble approaches. By incorporating cultural humility into our clinical guidelines, we can reduce the risk of cultural misunderstandings, which can compromise patient safety or family trust. Hong Kong's healthcare system serves remarkably diverse populations, including ethnic minorities who often face significant healthcare access barriers. For rehabilitation staff, this means recognizing that OI affects families from all cultural backgrounds in Hong Kong. We need to understand that rehabilitation approaches must be culturally adapted to be effective. And lastly, we need to acknowledge that effective care requires ongoing cultural learning and not a one-time training. This OI awareness poster represents more than clinical guidelines. It's a commitment to cultural humility in healthcare. By approaching each patient interaction with openness, respect, and genuine curiosity about their experience, we can create safer and more effective care environments. Remember, when in doubt, ask the patient or family. This simple principle embodies cultural humility that transforms healthcare from a series of procedures to genuinely healing relationships. Thank you for your attention to this critical aspect of patient care. Your commitment to cultural humility makes all the difference in our patients' lives.